This is We Can Be, and I'm your host, Chris DeCardi. I'm honored to be joined today by Dr. Margaret Larkins-Pettigrew, who is, first and foremost, an OB/GYN, also diversity, inclusion, and equity expert, maternal infant healthcare equity advocate, a global healthcare strategist, public speaker, and author. She is the first Senior Vice President and Chief Clinical Officer of Diversity, Equity, and Inclusion for Allegheny Health Network, and is a professor at Case Western Reserve University and Drexel University. Her passion for advocating for maternal health equity and building programs that improve outcomes for women, people of color, vulnerable patients, and marginalized communities is a common thread throughout her highly respected career. And she is a U.S. Navy veteran, as well as a sought-after guest for TV, radio, podcasts to discuss women's health issues and the broader context in society.
We want to check in with Dr. Margaret Larkins-Pettigrew.
I'm here with Dr. Margaret Larkins-Pettigrew.
Joining me now is the keynote speaker. We have Dr. Margaret Larkins-Pettigrew here.
Dr. Margaret Larkins-Pettigrew, welcome to We Can Be. So much of what you have focused on and talked about is around essentially giving birth, around children and mothers. What is it about childbearing and childbirth that is so perilous for both the child and the person who brought them into the world? What is going on?
Well, first of all, the experience, the journey of giving birth is an amazing experience, as an obstetrician gynecologist. We are concerned about both mother and baby, and everything's an emergency because we want to make sure they're healthy. And we know that the health of a country really is identified by the health of their children. In every country, the birth of babies and the health of mothers should be a priority, because if you talk economically, babies grow up to be productive citizens, and then they add to the economic will that every country wants to see. So this is a crisis that we have now because we're not really making sure we're investing in moms and babes.
And so if you think about the United States, the wealthiest country in the history of the world, and that we spend more on healthcare per capita than anybody in the world and in the history of the world, so the United States should have the best outcomes in the world for women and children in childbirth and thereafter. But we don't. Why not?
In fact, when we think about all the industrialized countries, we are the worst. It's multifaceted, of course, because we have grown and then actually backed up a lot of the plans that we have talked about over the years related to healthcare. Daniel Dawes wrote the book, 100 Years of Obamacare. 100 Years of Obamacare, and it really goes through the issue of how we got to where we are now. And we don't intentionally take care of all of our populations, no matter what we're talking about. We're talking cardiovascular disease, oncology, et cetera. We just have not invested in the healthcare of our individuals, our population as a whole. But we really have fallen short when we talk about mothers and babies. And there's many reasons for that. One of the things we talk about, that affects everybody is racism, right? We know that racism is around us, in us, through us, beyond us. We're all affected by it, no matter who we are, no matter what ethnicity we are. We know that one of the biggest issues in our country is that this whole issue of systemic racism that affects all of us. So we have a lot to do.
What does that mean from a solution standpoint? One of the things we've been proud to support here at the Heinz Endowments is work that you've been leading around a program with the Allegheny Health Network called First Steps. And First Steps has a set of principles, but I love the goal. Every baby in this region should celebrate its first birthday. Pretty straightforward.
Yes.
Part of First Steps talks about an approach called centering pregnancy. And so I wonder if you could actually just give a couple of examples of we know what to do so that we can understand what that means. That is a key part of this program.
Let me start with centering first, because that is a part of the First Steps and Beyond program that is practiced throughout the entire country. Centering pregnancy, the institution of centering, is a national organization that really says if we can put women together in their trimesters together, and that we give them support, psychological support, physical support, that we give them this bonding support, and the partnering with the institutions, the outcomes are better. And that has been proven to be true. So that is why centering should be practiced in all institutions that have labor and delivery areas and deliver babies.
I think one of the frustrations everybody experiences in healthcare, and I think healthcare providers, is that you essentially have to deliver healthcare on a human level in these 6-minute or 15-minute increments. Do I have this right, that if you actually have a cohort of women together, that collectively they can spend a lot more time with a single doctor who can help guide them and have a much longer conversation. Is that a piece of this, and is that a specific example of how that core plays out?
Absolutely, because when you bring a group of women together, then every woman has their turn actually being examined by the physician. But while they're waiting, they have another leader who's actually leading some conversations around some of their concerns and, some of the things that really would uplift them and help them move through their journey in a much more positive way. So just the model of centering is something that should be considered in not only just in pregnancy, in other practices as well, but it is one component of First Steps and Beyond. So the concept of thinking about how we decrease the death of all babies and allowing them to live into their first birthday, we want to make sure that's true. But we know that the increased number of deaths of moms and babies who are of color is significant. And it's across the country. Pittsburgh's not by itself. So if we can do things that intervene and decrease those higher numbers for African Americans and Black women, that we also decrease that for white women. So we're talking about everybody. So the negative sum game doesn't exist because everything we do is going to affect everybody and give everybody opportunity.
That's fabulous. It reminds me of a wonderful story that I think Angela Blackwell tells about the curb cut effect.
When we solve problems from the standpoint of those people who are most vulnerable, everybody benefits. The classic example is the curb cut. You see it in streets all across this country. They're there because of the advocacy of people with disabilities in wheelchairs. But the truth of the matter is people pushing strollers, workers pushing carts, pulling wagons, parents worried about their young bike riders not riding in the street, all benefit because of those curb cuts.
That broadening benefit to society, I am guessing that's a similar impact that you're talking about here. So what are the death rates for African American women in childbirth relative to white women? Or what is happening right now in Allegheny County for children who are not reaching the age of 1?
We're in a crisis and we need to act strategically to make changes. So in Allegheny County, we're just as high as most cities, 18 out of 1,000 deaths for Black moms. For white moms, it's about 12 out of 1,000. So no woman, no matter who they are, should be dying from preventive causes. No woman whatsoever. So we know across the country, Black women have a 3 to 4 times risk of dying in pregnancy than white women. And babies have a 2 to 3 times risk of dying for Black women. When you look at that, you listen to that, you have to say, what in the world is going on? And what is my responsibility in making a difference? And when I say I mean the person who's transporting someone from their hospital bed to ultrasound, the person who's picking up the phone and saying, how may I help you and direct you to the right care. It's all of us, all of us have to be involved in this. We have to embrace the fact that we are in a crisis. And how do we get out of crisis? We come together, we strategically and intentionally invest. We invest our time, our energy, and our money in those things that promise to have positive outcomes. And that's what we've done together. What we're doing at Allegheny Health Network, we can definitely see our numbers decreasing, but we know that if we're doing the right thing across the board, everybody's numbers are decreasing. We don't have that data to share with you. I can tell you, because I have the data, that we definitely are making a difference.
That's terrific. And it is our privilege at the Heinz Endowments to be part of that network, to be supporting your leadership, your work, the work of so many others that are in partnership with you. And you talked about the systemic racism that is in play here, and especially for African American women. If you're an African American woman and you are pregnant and you are engaging with your doctor and in the healthcare system, what are the manifestations of systemic racism?
We've done these focus groups, and out of those focus groups came the discussion from these women who said that they're just not listened to, that there's no partnership with the clinician, that there is this stereotypical belief that they don't come to their visits, that there's other things going on in their lives that do not make them healthy right off the bat. So the issue of not establishing this partnership with all women, but as a provider, you have a responsibility for making sure that you take time to establish those partnerships and to meet those patients where they come from. so that they are understanding that everybody who comes into their space, they have different lived experiences. The providers have different lived experiences.
So that makes a world of sense in the doctor-patient relationship, to have that humility, to understand your blind spots. I'm also curious if you know or have seen that if you have a diversity of backgrounds among a group of physicians, that actually can increase the awareness of those blind spots in the distinct cultural spaces that anybody would come from.
It's proven that diverse teams are more productive teams. And that's if diverse teams are talking to one another. Because you can work with someone on a day-to-day basis and never really know where they come from or what their values are, But it's important for them to actually come together, work together, but really develop as a team so they're talking to one another. And you'd establish that your values are very much the same when you talk about how you're taking care of patients and what you believe should be the outcome of patients.
So we're talking about this specific example. We're talking about first steps. You talked about centering pregnancy. This is not theoretical. You've done this.
Yes.
Put this together in Cleveland. What happened there and what is happening here in Pittsburgh now?
First Steps and Beyond is so much bigger than people think about coming together with a community. And we should be doing this in every aspect of what we do, business, health, legal system, how you really involve your community in identifying what those needs are. So, for instance, all the studies that were done in Pittsburgh that said that we had this very high rate of death around mothers and babies. Highmark decided that they needed to really jump in and say, how can we make this different? So, identifying what the problem was first, and we know the root causes for the death of Black moms and babies are obstetric racism, preterm delivery and death, sleep accidents. There's more sleep accidents than there are SIDS today, and what happens in that fourth trimester postpartum. We also identified that we have to think about how they come into the pregnancy. Are they healthy? Have we really spent a lot of time talking about controlling your blood pressure, controlling your diabetes, making sure that you're not obese, all of those things that make your pregnancy journey much healthier, right? But in that journey, that space of labor and delivery, partnering with your physician, we want to make sure that that's not traumatic for the mom or the birthing person, and then the postpartum period. Those are kind of the root causes that we wanted to focus on from Highmark. And we said, okay, so how do we do this? We can't do it by ourselves because we need to involve many organizations that are involved in the same thing. They want the same thing to happen. So we reached out and said, we need to come together. We need to leave our egos at the door, and we really need to focus on how we change the metrics. Here are all these organizations who are interested in focusing on this one goal. We have Healthy Start, Allegheny Health Department. We have all UPMC, and we have anyone who touches a mom needs to be involved in this. So we put together an executive team, and they make decisions about how we are going to uplift certain parts of the mother's journey. We also put together a community advisory board, and they talk about, what's happening in the communities. What are we talking about related to moms and babes? What is the fear that we see? How can we decrease the distrust that's out there? So women are afraid to have babies in Pittsburgh. Absolutely afraid to have babies in Pittsburgh, because we know that there's poor outcomes here. And so how do we actually decrease that? And so we do that by having this orchestra together that really focuses on this one issue. Did the same thing in Cleveland, doing the same thing here, saw the reduction in Cleveland. They're still continuing to work. And so we've done it here so far.
What is the reduction in Cleveland? What did you find over what period of time?
We found a reduction of 20% over a 5-year period.
That's extraordinary. So you said something in describing this program that I think is extraordinary, that women are afraid to have babies in Pittsburgh. Extraordinary. So I'm going to ask a question to try to see if I have this right. I am a woman who is diabetic and pregnant, and I walk into the system. Is the difference between a system that is broken and not serving at that individual level is that the African-American woman presents with diabetes, and the doctor essentially says, that's your fault, that's a problem.
The blaming.
And I think less of you as an individual and about your needs coming through this system. And everything you talked about sets an environment that says you're a human being. And we're going to pay attention to every aspect of that, and we're going to help you as an entirety through this journey so together we can celebrate the life you're bringing into the world. Is that an encapsulation of the distinction between these two outcomes?
That is the hope, and that is the change we are beginning to see. You know, we all come from different experiences, and many of us come from places where we've never had to even interact with people of different race and ethnicities. And so we are really burdened with stereotypes and things that we've learned over the times that we've been here. So we need to meet people where they are. We need to understand that we, as a society, have to embrace everyone with humility. And women, especially Black women, when they enter the system to get health care, it starts right off in many situations that they are blamed for their conditions. That I see changing. We as clinicians are making sure that we're partners with our patients. And when we listen to some of the issues that are happening to them, sometimes it's not clinical, sometimes it's around their social determinants of health that really are affecting it. But it's our responsibility to hear that and to try to get the resources that they need in order to make this pregnancy journey one that they are lifting up and feeling really great about. That change in that behavior is just only one piece of it, but is an essential piece to say to Black women, I hear you. Let's do this together. And that is what First Steps and Beyond has focused on.
Fraser Price is trying, but it's America who have the bragging rights again.
Track star and Olympic gold medalist Tori Bowie has died. She was 32 years old.
The tragic death of Olympian Tori Bowie prompting calls to raise awareness about Black maternal health. Two of Tori's Olympic teammates saying her death can't be in vain.
Bowie's teammate Tiana Madison, who like Bowie and Felix, also experienced complications in pregnancy.
All three of us have had this experience, and one of us didn't make it.
She didn't trust the hospitals. She wanted to make sure that the baby was going to be okay with her being in control.
You've actually decided to spend a significant part of your time telling these stories and lifting up these stories and having conversations into broader systems in that. Last year, you wrote an op-ed that ended up getting a lot of attention, and it was around the tragic death of Olympic gold medalist Tori Bowie from complications of childbirth. I wonder why that story so resonated with you, and what did you want to tell people?
The death of a child, any child in any place, is so traumatic, and we always think about people who lose babies in pregnancy who are African American and are in some place where they're socioeconomically deprived and they don't have the necessary support that they need. But in Tori's situation, she had everything. You know, she had a home, she had family, she, did wonderful things for this country and made us proud. Yet she was at home, pregnant, term, and she died from preeclampsia. We wonder, what happened? It was such deep thinking around why she didn't know the signs and symptoms that she was in trouble. And that falls back to not only literacy of the patient, but literacy of the clinician who took care of her. What happened that she didn't know, that she didn't recognize, that something horrible was happening to her? And so the whole issue of how we educate ourselves, how we educate our patients, how we spend time making sure that we are saying something that they can understand. The whole literacy, not speaking above their heads, really making sure that we map out that here are the symptoms and here's when you need to report for help. Because that was such a loss to me. I don't know what happened, but I do know that it shouldn't have happened.
I think one of the things that happens in a system that doesn't want to change is it says, well, it's not racism, it's people that are poor that don't have access, or it's people that don't have an understanding of how the world works, or whatever, right? All the excuses that sort of try to parse that out in a different kind of way. And it sounded like for you in this example, saying, no, here's somebody that on one level had it all. Somebody for our country was an icon and yet could happen to her.
Equity of care, right? Literacy is a big piece of equity of care. But every time you talk about health equity, people automatically say, poor, Black, whatever. And we have to understand that when we talk about and define health equity, it means everybody. It means Tori Bowie, who had everything. It means the white woman who lives out in Wexford, who may be in a situation where she's being abused by her significant other. Making sure we practice health equity is taking care of everybody. Our thinking has to be that when we talk about health equity, it means everybody. When we talk about diversity, it also means everybody. We all have to bring our learned experiences there. We have to be transparent. We have to be honest. And we have to be willing to be uncomfortable enough to be able to move on and really change some of the behaviors that we ourselves, all of us, possess that can hurt other people.
Where are we? Like, even with the language of diversity, equity, and inclusion, why is it in your job title? What is important about it and the work? And what does that mean for how institutions today are learning lessons, even of recent years, of trying to be better around diversity and inclusion, around equity and justice? Where are we?
Well, I think that we are in a better place. You know, we talk about George Floyd and what happened. I've lived through so many George Floyds in my life. And so many tipping points. Our country's lived through so many tipping points. We've had so many opportunities to move in a different direction, to embrace everyone in our communities. Yet we fail every single time. But there's something different about what we're doing now. There's something strategic about how we want to change for the better that I see across the country. I'm very hopeful. I really do see that we are in a different place, that people who would never invest in trying to understand other cultures or ethnicities are now doing that. My favorite phrase is from Malcolm X, when he was very much involved in trying to figure out how he and Martin Luther King could work together. It was all about health care. He said, when I becomes we, then illness becomes wellness. And I stick to that. And if we all could believe that, then we're going to move. And I think we're moving. We all have some responsibility and accountability to make things better.
We have a guest questioner that comes in. Our guest questioner is Carmen Anderson, who leads our program work in this area, who is also from rural Pennsylvania originally.
This is Carmen Anderson, Vice President for Equity and Learning at the Heinz Endowments. Margaret, we've known each other for many years. You've had an incredibly successful career. People may be surprised to know that you were the first in your family to receive a college education. The medical journey is long and arduous. What motivated you to persevere? And what would you tell young people who may be interested in medicine but can't see themselves there?
Oh my goodness. I can tell every young person right off the bat that you have a purpose, and you will find that purpose and live it with passion. But I think that making sure that you have those values and ethics that says that I can at someday step beyond myself because I'm an expert in order to be significant enough to make other people's lives significant. Young leaders or young future leaders need to very early on think about, those things, that it cannot always be about me. It's about me at the very beginning because you want to learn about you and you want to cultivate you and you want to make sure you're finding what brings you joy. But what can I do to step beyond that in order to affect other people's lives? In order to get to that phase, you have to be able to know you and know what your passion is in order to pass it on.
How did this become your passion?
My mom and dad. My father, of course, was a coal miner, and in the book I talk about this, that he went into those coal mines every single day with the intention of taking care of his family, to give his family a better life. And I can picture him, and I dream about him being in that darkness. But he didn't care because he had made a commitment to make a difference in our lives. And then how I was raised, I was raised, killing our own chickens, and we were hunting for rabbits, and very, very rural life. And what that did for me was expose me to other people who were poor, and there were many people who did not look like me. My godmother was a white woman, Margaret. She was a white woman who lived in our community because she was not allowed to stay in her own community because she married a black man. I spent a lot of time with her learning about the world and learning about colorism and the challenges of this world very early as a young girl. She made me think about this because I used to dream about looking like the people on TV, and I'd say, oh, when am I going to be that pretty? When am I going to have blue eyes? She said, that is never going to happen. And she would say, you are going to find those folks who will cultivate you no matter who they look like, who are going to treat you well. Those folks who treat you well and those folks who really want to know you will be the people who will be your allies. The chapter of the book, The Colors of My Heart, Embracing My Blackness with History, Family, Fear, and Faith, is based on being around people who didn't look like me. Today, I sit here with the same thoughts I had then, is that we cannot do this alone. We have to do this together.
To imagine a difficult and hard journey and to have mentors and guides that you describe is an incredible gift.
Absolutely.
And I think also, comes through. I mean, what you've talked about in our entire conversation is systems and looking at social systems and looking at ways to make sure that we bring diversity of understanding because it makes groups stronger working together, because it makes understanding the complexity of problems something that's easier to navigate in all of this. Folks that grow up solely within a social paradigm where they are represented directly as the dominant feature can often miss that opportunity, can have blind spots and not see them in that. In your book, you also write that these are lessons for leaders in the C-suite. What lessons and what connection between what you wrote and those individuals?
Well, understanding that governing through a social justice lens requires you to really embrace your own learned experiences, but to really open up your mind and your heart to understand others' learned experiences. And many times that doesn't happen in the C-suite. Many times the suites are full of white men who don't have multiple lived experiences or even exposure to other people in their lives. The governance that comes from those C-suites sometimes misses the mark because there are populations that we could really help not only survive, but thrive. And so if you understand how we got here, if you understand that we can do better, that requires you investing in understanding and really experiencing the lives of other folks, right?
That's really well said. And I think for me, as a white male leader in the C-suite, I have the privilege of serving as the president of the Heinz Endowments, that understanding this is a multifaceted journey. There's understanding myself as a human being, which I hope I've done through my life, and I hope I get better every day. But there's also understanding the water we swim in. And the water we swim in is as if not more important. So that if I am a saltwater fish in saltwater, I'm like, yeah, let's go. If I'm a freshwater fish in saltwater, there's no amount of freshwateringness that is going to help me without understanding that that environment is toxic. I think that's one of the hardest lessons, being in a socially or culturally dominant place. And the gift you have is this expertise and your ability to see inside and out of those systems, and then to spend your time and effort and energy trying to be able to build on that so others can understand. The name of our podcast is We Can Be. What do you believe we can be?
We can be better because we can do more. I don't want to leave anybody behind. No man is an island. No man stands alone. Each man's joy is joy to me, and each man's grief is my own. We need one another, so I will defend each man as my brother and each man as my friend. Did you record that?
That's like a mic drop from the beginning. That's fabulous. And that's like some pressure